Hey everybody, welcome to Mind Blown. Today we will go over how to deal with sleep paralysis. Make sure to watch until the end as we will give you some tips on how to handle when you experience sleep paralysis. While we usually think of being asleep or awake as clearly defined and distinct, conditions like sleep paralysis challenge these fixed boundaries. Sleep paralysis is a temporary inability to move that occurs right after falling asleep or waking up. Individuals remain aware during episodes, which frequently involve troubling hallucinations and a sensation of suffocation. These episodes of sleep paralysis involve elements of both sleep and wakefulness, which is why they can give rise to distressing symptoms. While much is still unknown about sleep paralysis, reviewing its types, symptoms, causes, effects, and treatment can better understand the condition and prevent it. What is sleep paralysis? An episode of sleep paralysis occurs when you're just falling asleep or just waking. You feel paralyzed and cannot speak or move. It can last a few seconds or a few minutes and feel quite disturbing. While experiencing sleep paralysis, you might hallucinate vivid waking dreams, leading to feelings of intense fear and high levels of anxiety. When does sleep paralysis usually occur? Sleep paralysis usually occurs one of two times. If it occurs while you are falling asleep, it's called hypnagogic sleep paralysis. If it happens as you are waking up, it's called hypnopompic sleep paralysis. What happens with hypnagogic sleep paralysis? As you fall asleep, your body slowly relaxes. Usually you become less aware, so you do not notice the change. However, if you remain or become aware while falling asleep, you may notice that you cannot move or speak. What happens with hypnopompic sleep paralysis? During sleep, your body alternates between REM, rapid eye movement, and NREM, non-rapid eye movement sleep. One cycle of REM and NREM sleep lasts about 90 minutes. NREM sleep occurs first and takes up to 75% of your overall sleep time. During NREM sleep, your body relaxes and restores itself. At the end of NREM, your sleep shifts to REM. Your eyes move quickly and dreams occur, but the rest of your body remains very relaxed. Your muscles are turned off during REM sleep. If you become aware before the REM cycle has finished, you may notice that you cannot move or speak. What are the types of sleep paralysis? In the medical literature, two terms are commonly used to categorize cases of sleep paralysis. Isolated sleep paralysis is when the episodes are not connected to an underlying diagnosis of narcolepsy. This neurological disorder prevents the brain from adequately controlling wakefulness and often leads to sleep paralysis. Recurrent sleep paralysis involves multiple episodes over time. In many cases, these two defining characteristics are combined to describe a condition of recurrent isolated sleep paralysis, RISP, which involves ongoing instances of sleep paralysis in someone who does not have narcolepsy. Who develops sleep paralysis? A 2011 review concluded that 7.6% of the general population experienced at least one episode of sleep paralysis. The numbers were notably higher for students, 28.3%, and psychiatric patients, 31.9%. Sleep paralysis can occur at any age, but the first symptoms often appear in childhood, adolescence, or young adulthood, ages 7 to 25. After starting in the teenage years, episodes may occur more frequently in the 20s and 30s, but men and women of any age can have it. Sleep paralysis may run in families. Other factors that may be linked to sleep paralysis include lack of sleep, sleep schedule that changes, for example, because of shift work or jet lag, mental conditions such as stress or bipolar disorder, narcolepsy, a long-term condition that causes a person to fall asleep suddenly, post-traumatic stress disorder, PTSD, use of certain medications, such as those for ADHD, substance abuse, general anxiety disorder, panic disorder, a family history of sleep paralysis. Is sleep paralysis a serious problem? For most people, sleep paralysis is not a severe problem. It is classified as a benign condition and usually does not happen frequently enough to cause significant health problems. However, an estimated 10% of people have more recurrent or bothersome episodes that make sleep paralysis incredibly distressing. As a result, they may develop negative thoughts about going to bed, reducing the time allotted for sleep, or provoking anxiety around bedtime that makes it harder to fall asleep. Sleep deprivation can lead to excessive sleepiness and numerous other consequences for a person's overall health. How is sleep paralysis diagnosed? If you find yourself unable to move or speak for a few seconds or minutes when falling asleep or waking up, then it is likely you have isolated recurrent sleep paralysis. Often, there is no need to treat this condition. Check with your doctor if you have any of these concerns. You feel anxious about your symptoms. Your symptoms leave you very tired during the day. Your symptoms keep you up during the night. Your doctor may want to gather more information about your sleep health by doing any of the following: ask you to describe your symptoms and keep a sleep diary for a few weeks, discuss your health history, including any known sleep disorders or any family history of sleep disorders, refer you to a sleep specialist for further evaluation, conduct overnight sleep studies or daytime nap studies to make sure you do not have another sleep disorder. What is the treatment for sleep paralysis? A first step in treating sleep paralysis is to talk with the doctor to identify and address underlying problems that may be contributing to the frequency or severity of episodes. For example, this could involve treatment for narcolepsy or steps to manage sleep apnea better. Overall, there is limited scientific evidence about the optimal treatment for sleep paralysis. Many people don't know that the condition is relatively common and thus see themselves as crazy or shameful after episodes. As a result, even just acknowledging and normalizing their symptoms by a doctor can be beneficial. Because of the connection between sleep paralysis and general sleeping problems, improving sleep hygiene is a common focus in preventing sleep paralysis. Sleep hygiene refers to a person's bedroom setting and daily habits that influence sleep quality. Examples of healthy sleep tips that can contribute to better sleep hygiene and more consistent nightly rest include following the same schedule for going to bed and waking up every day, including on weekends, keeping a set pre-bed routine that helps you get comfortable and relaxed, outfitting your bed with a comfortable mattress and pillow, set up your bedroom to have limited intrusion from light or noise, reducing consumption of alcohol and caffeine, especially in the evening, put away electronic devices including cell phones for at least a half hour before bed. Other things you can do to help prevent sleep paralysis: using antidepressant medication if it is prescribed to help regulate sleep cycles, treating any mental health problems that may contribute to sleep paralysis, treating any other sleep disorders such as narcolepsy or leg cramps, get regular exercise, but not in the 4 hours before going to bed, reducing do not sleep on your back. This can make sleep paralysis more likely to happen. Improving self-hygiene is frequently incorporated into cognitive behavioral therapy for insomnia, CBTI, a type of talk therapy that works to reframe negative thoughts and emotions that detract from sleep. A specific form of CBT has been developed for sleep paralysis, but more research is needed to validate its effectiveness. CBT has an established track record in addressing mental health conditions like anxiety and PTSD that may influence the risk of sleep paralysis. Some medications are known to suppress REM sleep, and these may help to stop it, though these medications can have side effects and may cause a rebound in REM sleep when someone stops taking them. For these reasons, it's essential to talk with a doctor before taking any medication to discuss its potential benefits and downsides. There's no need to fear nighttime demons or alien abductors. If you have occasional sleep paralysis, you can take steps at home to control this disorder. Start by making sure you get enough sleep. Do what you can to relieve stress in your life, especially just before bedtime. Try new sleeping positions if you sleep on your back. And be sure to see your doctor if sleep paralysis routinely prevents you from getting a good night's sleep. Even though waking up with an inability to move or speak can be incredibly upsetting, sleep paralysis usually doesn't continue for a very long time and isn't life-threatening. If you find yourself experiencing sleep paralysis on more than a periodic basis, visit your doctor to see if you might have an underlying condition. Tell them if you've ever had any other sleep disorder, and let them know about any medications and supplements you're currently taking. If you find this video helpful, be sure to hit the like button and share it with someone who needs to hear this. Subscribe and hit the notification bell to get notified whenever Mindblown posts a video. Thank you so much for watching, and see you in the next one.